is setting priorities. So in nursing school, you will have these questions about, hey, which patient should I see first? And then in real life, once you become a nurse and you have like 5 or 6 patients, then you need to plan your day of which patient should I see first. So first, what you're going to always focus on, first priorities is ABC. So airway, breathing, and circulation. So if the patient has any airway problem, if the patient is having any breathing problem, we are for sure going to go to them first. And then circulation. If that patient is having any circulation problems or any cardiac problems, then you want to go see that patient. If that patient is having sudden vital sign changes, super high vital signs, super low vital sign changes, then you want to go see that patient as well. Also, lab interpretation. If a patient has a super high potassium, then you know you need to go see that patient. If that patient has a super high calcium, you know you need to go see that patient. Or if a super low potassium, things like that. So it's important that you know your lab values, and that you also know your normal ranges for your vital signs to say that, okay, if I'm presented with a patient and their lab value is this, I know that this is a priority. All right, so another priority is changes in mental status, untreated medical problems, pain, urinary elimination problems, all those things. The biggest thing I want you to understand is that after you dealt with airway, breathing, and circulation issues and vital signs and lab values, we then can move on to Maslow's hierarchy of needs. So I have that on the screen. So as you can see, you want to then start with the bottom row. So where there's your psychological, food, water, and those type of things, and then you move up to safety and all those things. So you would just go up the ladder. So a lot of times students, they always go for airway. They're going to pick airway no matter what. But that is true if the question is stating that the patient is having current airway problems. The question may just say the patient has a history of COPD. If they just have a history and they're not currently in an exacerbation, then that patient may not be a priority. So I want you guys to remember ABCs: airway, breathing, circulation. And then if we don't have any of those issues going on, we're then going to move to Maslow's hierarchy of needs. It is so also important that we pay attention to mental statuses changes in a patient, behavioral changes in a patient. It is so level of consciousness in a patient. It's important that we pay attention to that. So that's why it's so important to early assess our patient. So we asked our patient their name and date of birth and where they were. At 9 o'clock, they were able to answer all those questions. Now, when we came and do our 1 o'clock meds, we noticed, we asked them their name and date of birth and where they were at, and they now couldn't answer these questions when at 9 o'clock they could. So what has happened during that time, especially if that patient has no history of dementia or history of Alzheimer's? So it is so important that we pay attention also to subtle changes. One thing I always teach my students when it comes to vital signs is trend vital signs. So you then want to start to look at, the average of the patient's, blood pressure. So if you check it and it's 130/80, I want to see what was it the time before that. I even want to go back maybe to the day before and see what was it. And just to keep a little file of it. And then when I check it again, I see that, it's 140/80. So I see that their blood pressure is trending up. So it is so important to try to analyze your vital signs and lab values, and always pay attention to the subtle changes. The subtle changes. That's what separates nursing from any other profession, that we notice those subtle changes, right? And if we could notice those subtle changes and we could then develop a plan of care around those subtle changes, we then could prevent something big from happening.